Hi, I am Dr. Pavis. We are going to discuss nasopharyngeal cancer, the spread of nasopharyngeal cancer. As the spread of nasopharyngeal cancer can be local, the first question is, where does the nasopharyngeal cancer arise? What is the site of origin? The site of origin of nasopharyngeal cancer is fossa of Rosenmuller. When it originates in the fossa of Rosenmuller, it goes inferiorly to nasopharynx and hypopharynx. It goes laterally to infratemporal fossa and parapharyngeal space and through the site of Morgagni, and then it may spread posteriorly and may involve foramen magnum and may affect the cranial nerve 9, 10 and 11, and then it may go superiorly to foramen lacerum and foramen ovale, and it may affect the cranial nerve 3rd, 4th, 5th and 6th. 6th cranial nerve is the most commonly affected cranial nerve. It is the first affected cranial nerve. It may cause diplopia and ophthalmoplegia. After that, this cancer, it may go to middle cranial fossa through foramen ovale and through foramen magnum to middle cranial fossa and enter the brain. After that, we have that involvement of the parapharyngeal space laterally may involve the pterygoid muscle, and there may be trismus, and also it may involve the hypoglossal canal and may cause Horner's syndrome and affect the 12th cranial nerve, the hypoglossal nerve. Then we have the lymphatic supply. Nasopharynx is very rich in lymphatic supply. It may spread through lymphatics to the cervical nodes. Cervical node may be affected. At the time of diagnosis, 75% of the people have a unilateral or bilateral or contralateral lymph node spread to cervical lymph adenopathy. We have cervical lymph nodes, then we have retropharyngeal nodes and parapharyngeal nodes. So lymphatic spread can be to cervical, pharyngeal, to retropharyngeal and parapharyngeal nodes. When retropharyngeal nodes are involved, it may cause torticollis and pain and tenderness in the neck. Then we have the distant metastasis. Distant metastasis may go to bone, lung and liver. BLL, bone, lung and liver. And then we have we may also discuss in next section, in next videos. I have discussed other parts of the nasopharyngeal cancer. Kindly like and subscribe and watch my other videos. Thank you very much.